Hi everybody, I'm going to be talking a little bit more about tendinopathy with the particular example of the posterior tibialis tendinopathy here. We're going to talk a little bit more about the patient positioning as well as discussing the protocols that you may use for tendinopathies generally, but we'll go over a little bit more with regards to the tib post tendon, so that when you get back into clinic and you're starting to diagnose this, you can start saying, okay, well, this is what I'm going to do with my device. This is how we need to think more holistically about not only the insertion, but potentially that mid tendon, as well as sort of the muscle belly there as well. Now, of course, this is all in conjunction with all of our other complementary therapies that we're going to be doing at the moment, whether that's orthoses and definitely strengthening, eccentric strengthening, but bringing it all together with an aspect of PBMT here. Really what we're wanting to do is, make sure the patient's in a comfortable position for them, but also for us. And, I do harp on about sort of practitioner ergonomics. So make sure that seat's high enough, they're tilted back in my case, and in the case of, this photo here, so that we can make sure that the patient is going to be comfortable and we're going to be able to get access to that site as well. When we're looking at the, what I'm going to be doing around each area, I'm really wanting to reduce any edema, and in the case of this one, this is a post-surgical patient that we've got here that's has some recalcitrant swelling there, and so putting some anti-edema. And if you're finding that swelling, or there's effusions off the tendon, or there's some concerns there, you may need to go more proximal to make sure, around the malleolus for wherever that might be. Maybe it's the perineal longus and you need to make sure that, okay, well, actually we're really at that plantolateral border. So start considering a bit more broadly what we're looking at. With the MLS M8, I've got a fantastic setting that is tendonitis, and I'll typically do right through from sort of this midfoot right through to the rear foot, where the tendon's sort of then coming into the muscle belly a little bit further up, and making sure that I'm going to be targeting that whole tendon area so that I can ensure that the tendon's going to be healing, increasing the strength, and then coupled with that exercises is just going to be on the right path as well. But you do need to make sure that you're not neglecting the muscle belly. Obviously the tendon can't stretch, and so by releasing any of those trigger points and putting something on like a contracture setting to make sure that the muscle's more like jelly is how I explain it, nice and loose and free, and that fiber alignment is going to be a lot better, then that's where we're going to be much better off when we're looking post PBMT therapy. Let's take a quick look at what this looks like. You can see here that I'm sort of treating just more locally with my anti-edema and getting that whole area where I can of where there might be some swelling. After that, I'm then going to be doing that whole rear foot with regards to the tendonitis. And here we can see a little bit more and how high I'm going with that, as well as how much more anterior that I might be going as well, to make sure that it's as effective as possible. I really do like to treat as comprehensively as possible. Then we're going up through to our muscle belly. Do go a little bit more superior and inferior to that area to make sure that you're really freeing up everything that you can. Doing a few trigger points is going to put them in a much more comfortable position. And typically, for my device, I'll do the trigger points whilst I've got the foot going, so that I can then sort of go through and, have a bit of a feel of where those trigger points are, and then undertake them, because it's the best thing that you can do to make sure that your patients are going to get that good outcome that we're looking for. Hopefully this has given a little bit more of an idea of sort of the protocol that I use. I think, looking at that, at the site of injury, as well as then coming up and double checking the muscle belly, is really important in all of our tendinopathies. You can't just treat the insertion, you must treat where some of that pain is coming from, which is at the muscle belly. Start thinking broadly, about the biomechanics and how you can unload that tendon completely, or that muscle by, shifting how people are walking. Okay, but really what we're wanting to do is reduce the edema, increase that tendon healing, and then reducing the contracture that may be associated with the muscle belly. Of course, always treat holistically, and the PBMT is going to be in addition to any eccentric strengthening, and then building up from there. But hopefully this has given you a bit of an idea in relation to the post-tib tendon, but thinking more broadly that you're going to be really looking at a few different aspects there as well. We'll see you in the next session. Cheers.